How does a doctor fail to diagnose an impending heart attack? Would you like to learn what this is all about? Come join me as I share with you this great information. Hi, I'm Gerry Oginski. I'm a New York medical malpractice and personal injury trial attorney practicing law here in the state of New York. A gentleman wound up having significant chest pain. A young man goes to his local emergency room and they do the right thing. They do a full cardiac workup. And then they tell him, listen, we can't find anything wrong with you from a cardiac standpoint. What we want you to do is follow up with a new cardiologist, and he'll evaluate you from time to time. And that's exactly what this young man did. He'd never been to a cardiologist before, and so he began seeing a new cardiologist once a month for the next 3 months. Every time he went to the cardiologist, he told them about his ongoing chest pain and that it was getting worse and worse. The cardiologist did some additional testing and told him, listen, there's nothing here cardiac, just continue doing what I told you to do, take this basic medication and you'll be fine. Well, one night he woke up in excruciating chest pain. He couldn't sleep, he was having massive sweating, and finally his wife called the ambulance, took him to the same emergency room that he originally went to 3 months earlier, and there they diagnosed him as having a massive heart attack. When this young man came to me with his wife, they were concerned that the original doctors failed to recognize his heart attack. We had to get the original emergency room records, and then I had not one, not two, but 3 different cardiology experts take a look at those records. And they all said the same exact thing. They all determined that the original records were not interpreted correctly. In fact, it was an EKG that was misinterpreted by the cardiologist in the emergency room. What was interesting was that the computer had interpreted this EKG as being abnormal. But the cardiologist who read it ignored those findings and instead said, you know what, this is absolutely normal, don't worry about it. All 3 of my cardiology experts confirmed that if this patient's condition had been correctly diagnosed when he first went into the hospital, they would have done additional testing such as an advanced angiogram, which would have confirmed that he had massive blockages to the 3 main arteries that supply blood to his heart. And then he would have had a triple bypass surgery, a heart bypass surgery. And had he done so, that would have prevented this massive heart attack from occurring. So why do I share this great information with you? I share it with you just to give you an insight and an understanding into how a cardiologist failed to timely recognize and diagnose an impending heart attack. You know, in all likelihood, you have questions or concerns about your own particular medical malpractice matter. And if your matter happened here in New York and you have questions, what I encourage you to do is pick up the phone and call me. I can answer your legal questions. I do this every single day and I welcome your call. You can reach me at 516-487-8207 or by email at lawmed10@yahoo.com. That's it for today's video. I'm Gerry Oginski here in New York. Thanks so much for watching.